Yeah, welcome to PAATHSHALA day 2, that is DM day 1. Hope you are enjoying the journey of solving many MCQs. Some of them you might have already been done by you, and many will be looking like new MCQs as well. Okay, so for DM today, you have the schedule like Monday, Wednesday, Friday, Tuesday, Thursday. As of now, Tuesday, Thursday is your DM. Monday, Wednesday, Friday is your physio, and Friday we have kept for Pharmac. Theory Pharmac Friday. Okay. As of now, the schedule goes like this. You already have received. After this, like 2 weeks, DM and physio, when they will be over, two more subjects will be introduced, like the same thing. Monday, Wednesday will be one subject. Tuesday, Thursday will be another subject. Chapter by chapter, we will solve questions which are of relevance. Today, after like DM session, I'll share one assignment also for your self practice. Okay, even we will be able to share, I think, by day end for physio endocrine system, which was done yesterday. So how is the things, like how was the day one? Anyone? Yeah, good morning everyone. How was the day one Pathshala? Sounds interesting and sounds achievable, doable. Good, chalo, good. Dr. Shreya, actually speaking, we didn't finish off endocrine, you did. You guys came prepared, you studied endocrine system a day before the physiology. That is how and why you were able to solve the questions the next day. This is how the things should be done. Now, another important thing which I'm going to repeat, which I did it in the orientation, you have the hard copies of these MCQs, which was sent to you via booklets. Circle the questions, like today when we are going to discuss these, say, 100 questions of dental cement. Whatever questions you feel in the first go, in the first reading, sound difficult, vague, not comprehensible, something not read by you, just circle those questions for the while, and the next task is from tomorrow onwards keep on revising these questions, the circled ones. That is how you have to do it. And I would say, when you're marking, keep pen and pencil together in your hand. I'll just give you 2 minutes, 3 minutes to get hold of one pencil. In the MCQs, mark with the pencil in the hard copies. Okay, when you're marking on ABs, like you're marking C, D, whatever, do it with a pencil so that you can erase them later on, especially the circled ones. I'm not worried about the ones which you're doing it correct. I'm worried about the circled ones. Mark only with pencil. That is why I mark all the MCQs with pencil and erase them when you want to re-practice them. Okay, as such, not to worry. There is another way of re-practicing. These MCQs, we will give them as a test somewhere, so you will not be lost. Okay, but it's a good practice to use pencil. Like I always carry pencil with me when I don't use pen in my books, right? Very rarely I use pencil also. So let us start. Chalo, great, Dr. Sonal Singh. uh, let's start with dental cements. Cements is a vast chapter because of a lot of variety of materials. One or two questions always there in your NEET, MDS and INICET exams. A clinical procedure, question number one. Without burrs. See, read the question very carefully. It is without. The without is without burr, without air, water, without anesthesia. Okay, without burr, without air, water spray, without anesthesia, only the manual excavation. So it cannot be preventive endodontics, it cannot be prophylactic odontotomy. It can be pit and fissure. Can it be pit and fissure? Somebody? One ka D is okay. Chalo, ART, you know that. Okay. ART, you know. Which GIC is used in ART? Which GIC is used in ART? Which glass ionomer cement type is used in ART? Yeah, that's a confusion. Classification base say 8, Phillips say 9 in the photograph. So it's controversial. Let us take no Dr. Uma's history. We will see it in subsequent questions also. ART is GIC classification number 8, and the brand name is actually Fuji 9. Fuji 9. Coming back to pit and fissure, can pit and fissure be done like ART? Yes, pit and fissures can be done. The basic criteria for pit and fissure is non-carious pits and fissures. Non-carious, most important criteria. If there is clean evidence of caries present in pit and fissure, you never do pit and fissure sealant. As per your MCQs. As per your MCQs. Okay, forget about what is being practically done and all. Even some literatures say that even like after doing the excavation, well, a widening of the pit and fissure, there is a slight hint of caries. That means still you can proceed with pit and fissure. There is an evidence in this regard. But abhi ke liye for MCQs, note this for sure. Okay, it is only for non-carious. We have pit and fissure material which is available like self-etching, self-adhesive, and self-cure. Something like universal cements. These type of pit and fissures are available. What you have to do is, say suppose this is your occlusal surface, you just widen your fissure, take a micro applicator brush, apply this pit and fissure, say you apply like this, and just leave it. It will etch also, it will bond also, it will cure on its own also. You just have to wait and watch or listen to some nice song. I have been using this for last decade. It's not a recent material, it's a one more than a decade actually. I have been using this. It's by 3M company. Okay, so such materials are available. You should be aware of this. But here, when we talk about the question, what they talk is carious. This is the catch. That is why I was giving you an outline. Don't just jump on conclusion. And such questions, pit and fissure is the first option. Most of the students might get carried away with that. Right? Carious means no pit and fissure. And the term restoration with type 2 fluoride releasing cement. Pit and fissure is not a cement. Okay, so answer is ART. Understood why pit and fissure, though it can be used without burr, without water spray, without anesthesia. But still, the answer is not pit and fissure here. Right? A substance, question number 2. Substance that is hard, brittle, amorphous, non-crystalline. This is just a property of something called as glass. We will see it in ceramic. Okay, we will see it in ceramic. This is the basic structure of glass. Okay, sodium alumina silicate glass, potassium alumina silicate glass, or sodium alumina fluorosilicate glass, many classes. Next question, question number 3. A viscous material placed between the two structure and the processes that hardens through chemical reaction to firmly attach the processes, say a crown and a two structure. What it is called? Yeah, luting agent. Luting agent. The term film thickness is important for luting agent. Ideally, the film thickness should be less than is equal to 25 microns. This thickness is given in relation to the gold standard luting cement. Gold standard luting cement, that is zinc phosphate. Zinc phosphate has even up to 18 microns. This is the only cement which has a film thickness less than 25. Ideally, it should be less than equal to 25. Ideally. Okay. Highest film thickness is made by resin cement. But still, resin cement are considered the best for luting, but luting mainly of the ceramic processes because of their high compressive strength plus virtually insoluble in water and oral fluids. Virtually insoluble in water and oral fluids. What is film thickness? Film thickness is not the thickness which you are mixing. Say this is my glass slab, you take powder and you liquid and what you mix, this is not the film thickness. Film thickness is when you place a cement between two optically flat surfaces. Okay, I've given you all these definitions in your synopsis. Not to worry, you can read them later. Just listen it. When you place your cement between two optically flat surfaces, that is like two glass slabs, and you apply certain load for a certain duration of time, the thickness which we get after that is actually called as film thickness. And this is the film thickness. It is in microns, not in millimeters. Most ideal luting cement as per film thickness criteria or the gold standard material is zinc phosphate. Zinc phosphate. Okay. Then there are certain protocols. Say suppose this is my crown prep. You have done crown prep and this is my crown, which is to be cemented onto this crown prep. Yes, Dr. Nikita. For ceramic, only resin cements. We will discuss that, not to worry. Abhi try understand certain luting protocols. Luting protocols. There is a crown. This is the top portion of the crown or the coronal portion. This is the back portion where the cement will come. This surface is called as intaglio surface. Okay, intaglio, the cavity portion of the crown. Cavity portion. The cavity portion of the crown is called intaglio, where you put your cement. Important criteria is you should not load your cement more than 50% or less than 50% of the crown cavity. Your luting cement should occupy not more than 50% of the crown cavity. If it is more, excess will flow out and it will become difficult to manage your flash. Right? Right? Then there is like interface being created. Interfaces. First interface is between the crown and the cement. This is an important MCQ. Cement interface. Cement tooth interface. This is my crown. and in between the crown and the tooth will come my yellow color. This is cement. This is my cement. So we have three interfaces. One is the interface between the crown and the cement. Another is between the cement, and third is between the cement and the tooth. Question comes, which will show failure and when? Remember, cement is the strongest actually, or it usually doesn't show any failure. See, if your cement and cement layer are separating out, it actually means you are using a very weak cement. And we don't want to use a weak cement to lute a permanent crown, right? Weak cement like zinc oxide eugenol. Zinc oxide eugenol cement interface will break because it is a weak cement. But we are not using zinc oxide eugenol for the fixing of the higher processes, permanent processes. So this, as of like you can say theoretically and practical purposes, we take for granted this is the strongest phase and this does not break. So breaking part will come either in 1 or 3, but that depends on a certain condition. And what is that condition? It is the type of cement being used. Type of cement being used. By type, we mean either the cement is chemically bonded with to structure. These cement are also called truly adhesive cements. And second one is mechanically bonded cements. Chemically bonded, mechanically bonded. Two classical examples of chemically bonded are zinc polycarboxylate and GIC. And here we have zinc phosphate, we have zinc oxide eugenol. Okay. Even resin falls under this category because of chemical bonding. So question in NEET which has come in the past is, hope you're getting this point, the three interfaces. This point is clear. In your PYQ, there is a question. A patient come to you for crown cementation with zinc polycarboxylate. Zinc polycarboxylate. Which interface will show failure? Which interface will show failure? Crown cement, cement, cement tooth. Anyone? Any guesses on this? See, this is not going to show failure. We have understood this. Okay. Now the question is this or this. Zinc polycarboxylate is a truly adhesive cement. No, Dr. Sunny, Dr. Nandgopal, answer is wrong. Right? It is a truly adhesive cement. So zinc polycarboxylate bond with tooth will be stronger. Or you can say a chemical bond. So cement tooth interface will also not break so easily. So which one will break? Crown cement interface. Crown cement. But if the question would have been zinc phosphate, more chances of this is there. Answer will be crown cement tooth. Why? Because every crown we make in the lab, the intaglio surface we do sand blasting. This we will study in casting procedures. Sandblasting. Just I am giving you an overview. It is sandblasted. What sandblasting will do, it will create micro porosities in the intaglio surface, which aids in the mechanical interlocking of the cement. Right? This is how your cement is mechanically interlocked inside the crown. And this is very important. Zinc phosphate is a cement which is specifically designed to lock mechanically. And the sandblasting is done on the intaglio surface. We are not doing sandblasting on the prepared tooth. So mechanical interlocking between the zinc phosphate and the crown is any day going to be stronger than the mechanical interlocking between zinc phosphate and the tooth. Because tooth we are smoothing up after doing a crown prep. When you do a good crown prep, say this is my crown prep, it is advised to do it the finishing of the crown prep to make it little smoother. Okay, because otherwise the wax pattern will create a problem, right? So this point is important and this is should be clear. So coming to our question, no, this was the question, luting agent. Okay, hope this all information you have noted down and it is important you have understood for the luting protocols and luting cementations, right? Now another thing, chalo, is make one more thing I'll add. When you lute your crown, when luting of crown is done, excess cement flows out as flash, and this flash has to be removed. Now there are two possibilities to remove the flash. Either you remove the flash immediately, like once you press your crown is loaded with 50% of the cement, you press the crown, excess will come out. One is you immediately remove it. The other is you wait for the initial set of the cement, luting cement. Initial set of luting cement. Which one is preferred? It's not about my preference or your preference. It is about, again, the type of cement being used. Again, the same type. If the cements are truly adhesive cements or mechanically interlocked cements. If it is truly adhesive like GIC or zinc polycarboxylate, remove them immediately or as fast as possible. If it is mechanically interlocked like zinc polycarboxylate, this. No, Dr. Shanki Sita, the resin is done little in a different way. I'll tell you when we'll do the cementation protocols of veneers and laminates. Okay. This thing again has to be remembered and important. But sadly, what I have seen in so many years of practice and working with many dentists in my initial days, almost every dentist I have worked with, I can tell you, MDS also, BDS also, big shots also, they have been doing it wrong. They have been doing it other way around. I don't know why nobody bothers to read Phillips actually. Once they pass out of the BDS, don't stop reading. That is the motto. That is the purpose of becoming a doctor actually. When you call yourself as doctor, you have to keep on reading, studying rest of your life. Whatever like comes across. Like if you want to use a new material, you should read about it. If you don't know how to use a material, read about it. Nobody is stopping you. Even after MDS, when you start your own clinics and all, and you see not everybody is well versed with everything around you. Okay, so there will be few things which you might have forgotten or just lost over a period of time. The things might not be able to recall. There is no harm, there is no hassle reading your book Phillips or watching some video on YouTube nowadays. It's easy. Okay, so don't do these blunders. Read the book, follow them. The books have been written so nicely after so much of research, so we should take advantage of that. Filling material or prosthesis used to restore or replace a tooth, a portion of tooth, or multiple teeth, or oral tissue is called. This is a very generic question. It is called restoration. Nothing great, okay? These are questions actually made from the lines of the Phillips. Okay, they are not of Dental Pulse or Gauri Shankar. They are lines from the Phillips. So this question is like directly from there. Example of self-adhesive restoration. I told you self-adhesive. Or true adhesive. Question number 5. Yes. And GIC. See, if polycarboxylate and GIC are in the option, composite will never be the answer. Zinc polycarboxylate was the first truly adhesive cement. First, first truly adhesive cement. Right? Ignaz, let us do one small chart. I always start my lecture also with that. Most of the cements show ionic reactions, chemical reaction, which are in the form of acid base reaction. Acid base. Acid is usually present in the liquid, base is in the powder. Most of the cements, okay, most of the cements show acid base reaction, chemical reaction. Acid is in the liquid, base is in the powder. So let us make a small table which will help us answer many questions in the coming MCQs. Name of the cement, what is the powder, that is base, what is the acid, that is the liquid of the cement. Zinc phosphate, zinc polycarboxylate, zinc oxide eugenol, GIC silicate. Powder consists of zinc oxide, main ingredient. Zinc oxide, zinc oxide. Take mommy. Okay. GIC contains fluoroaluminosilicate glass. Fluoroaluminosilicate glass. Zinc phosphate contains phosphoric acid, Pa. Polyacrylic acid, PAA. GIC again contains PAA. This contains P. Note it down, understood? Now many questions surround this. Sometimes they ask you which two cements have got the same base, same powder, same liquid, and so on. So these two have got the same liquid. These two have got the same liquid. These three have got the same powder. These two have got the same powder. Right? You can easily, once you make this table, you can easily identify it. Important is PAA. The cements which contain polyacrylic acid. Polyacrylic means, poly means many, many types of acrylic acid: tartaric acid, itaconic acid, malic acid, oleic acid, stearic acid. It can be anything. Okay. So the cements which contain polyacrylic acids are the truly adhesive cements. True adhesives cements. They bind to with calcium of tooth, which is like enamel or dentine or both, chemically. What is binding chemically is actually polyacrylic acid. What is binding chemically is polyacrylic acid. The freely available polyacrylic acid in the cement is going to bind with the calcium of the tooth, and that calcium is present in hydroxyapatite crystals of enamel and dentine. Enamel and dentine have got inorganic portion, you know that, right? So important is we have two cement, zinc polycarboxylate and GIC. The GIC polyacrylic acid, the GIC cement binds to both enamel and dentine का calcium, but zinc polycarboxylate only to calcium of enamel. That is the reason zinc polycarboxylate has got limited use. GIC has got extensive use. GIC has got extensive use. Nowadays, as such, we are not using polycarboxylate. The time elapsed from the starting of mixing point to the consistency of a material no longer suitable for intended use. This is the definition of working time. This is the definition of working time. If you just change it slightly, instead of no, we write which the consistency of material is intended to use, then that becomes definition of setting time. So setting time is defined as the time elapsed from the starting of mixing to the point at which the material is intended to be of some use, or material has gained enough strength enough strength, to be intended of use. Material has gained enough strength to be intended of use. This is your setting time. All of the following cements have their liquid as acidic solutions or proton donor. Acidic means proton donors, except. Now you tell me, question number 7, we have just done this concept. Yeah, this is working time. The answer here is working time. The setting time is just cut no, and it becomes setting time. All of the following cements have their liquid as acidic. Setting means intended to be used. Yes, all have acid solutions. This has PAA, this has PA, this has PAA. Okay. Question number 8. The use of fluoride releasing material. Generally, the fluoride releasing cements we have are GIC, RMGIC, silicate. Okay, we have some fluoride releasing composites also. Fluoride releasing Pitt and Fisher chelates. When we want fluoride release, patient with low caries activity, why we want fluoride? We don't want aesthetically conscious. No, fluoride has got no relation with aesthetics. Patients with high caries activity. See if any one of the option is wrong. What is the rule of marking all of the above? Rule of marking all of the above. If two options are correct, you are very sure that two options are correct. Third one you are not sure of. Still you can mark all of the above. Iota. Okay. If any one option is incorrect, you know it is wrong, you are dead sure, don't mark iota. Don't mark. Okay. Also, there is a catch most of the times, like 90% plus, when two options are of contrast, exactly opposite, like patient with low caries activity, patient with high caries activity. They are the two contrasting or opposite options. It means answer is actually one of them most of the times. Then when you just keep on, now in PAATHSHALA you are going to keep on revising solving MCQs, so you might try to put your own statistics into this. You can start counting how many times this rule has been applicable. Okay, these rules are helpful only when you don't know the question. Okay, it's always better to know the question, know the topic, know the concept, know the answer, or maybe you come to some conclusion or solving the question. But sometimes, like if you have no idea what is happening, you can apply these rules and save yourself in the main exam. The use of dental cement as a restorative material began with, which was the first cement which was used to be intended as a for restoration. First cement. The answer is actually silicate. Okay, silicates were the first directly used tooth colored restorative materials, TCRM. First, directly used tooth color restorative materials. Okay, but now silicates have been discontinued. The important part of silicate is they had the refractive index similar to that of enamel. Now, this is your homework. You have to tell me tomorrow or in the WhatsApp group what is the refractive index of enamel. This was the cement which has the refractive index matching with that of enamel. That is why silicates were the most aesthetic cements. Most aesthetic cements. Dr. Shreya, I am talking about refractive index similar to enamel. Okay. And you are talking about similar to dentine. No, it is not 1.16. Yeah, it is something like 1.63, 1.65. Okay, just see your textbooks or else we will discuss in the group. Right? Silicate advantage was it is the most aesthetic, highly aesthetic cement. That is why it was used in the anterior teeth. Plus another advantage, very, very high fluoride release. Or you can say the highest fluoride release is of silicate cement. Highest fluoride release is from silicate cement. Which notes, Dr. Shreya? Which notes? Say refractive index similar, it is wrong. Whatever is written, it's wrong. Must be a typo error. No book can say actually refractive index similar to Dr. Shreya. It is, I don't know, which I have never taught this in Excel too. If somebody has written it wrongly, I can't help it. Okay. Anyone can easily vouch for this. Like I know most of the you have already given the NEET. Any student who has heard of that silicate cement has ever been refractive index compared to dentine. See, that is the difference when you depend on others' notes and somebody else has made a mistake. It's not, I would say, the student was writing wrong or student is wrong. It's a typo error, it's a human error, it's something like we are listening to something and we are writing some like many a times happens with everybody. Okay. And problem is you copy pasted that those notes because you are totally dependent on that. But when you make your own notes, you are in your most of the time in your own senses, right senses. Okay, I'm just asking openly. Anyone who has studied and given NEET this in 2025, all of you, most of you in PAATHSHALA have appeared in NEET. So, have you ever heard of like comparison of silicate cement refractive index with dentine? Yeah, silicate and silicophosphate are same. Silicate and silicophosphate are same. There is only one cement with silicate glass and phosphate. Okay, silicate glass because it is in powder, phosphate because it is in phosphoric acid. Yeah. चलो इसके पहले ये कर लो. I'll tell you what is the funda of this. Okay, that is again something you should be aware of. It used to be asked in somewhere 2009 to 12 ke papers. If you check of NEET, you will find such a question. What Dr. Shreya was mentioning. Silicate, very, very high fluoride release. Its fluoride release is comparable to APF topical gel application. APF gel application. So high fluoride release. Okay. Topical APF gel application. But and because of its aesthetic, it was used in anterior teeth. These are the advantages. What are the disadvantages? Disadvantages. These are the advantages of silicate. See, one by one, we will discuss all the important properties of all the cements. Okay. So this is how we read the theory also in PAATHSHALA. Disadvantage. What is the disadvantage? Is the pH. pH is too acidic even after application onto the tooth. And it remains acidic for approx 1 month. 1 month, which is huge. Okay. So if there is dryness, it used to lead to pulpal damage. And dryness is related to mouth breathers. That is why the question comes, which cement was strictly contraindicated with mouth breathers? Answer is silicate. Now you can correlate. Silicate has a problem of highly acidic pH even after applications. Where we were applying silicate, we were applying in the anterior teeth. And mouth breather will breathe from mouth. A lot of air will pass through the anterior teeth. So dryness of anterior teeth will take place. This dryness will initiate a lot of pulpal response and pulpal damage because of the already over acidic environment in the silicate. Right? Most of the time with after 1 month, silicate restorations were found to undergo RCT. So there was not point of using such a material. If at all, these materials were like being placed very close to the pulp in the dentine. So this is one major problem which has, that is why it has been discontinued. Now talking about refractive index, there are two aspects of a tooth. Okay, there are two aspects of a tooth. What is happening of for eraser? object eraser. This is my central incisor. Okay, chalo nahi, I'll give you a better example. This is my central incisor, this is my molar. One is clinical appearance. If I have to do this restoration, class 4 restoration, the ultimate topmost layer is going to be merging with your enamel. So refractive index of this has to match with that of enamel. Otherwise, the restoration will look different than the tooth, which we don't want in the aesthetic world. Nobody wants, even though you might not have done, say, class 4 even once or more than once in your life, but you have this much understanding of dentistry and knowledge that your restoration should not look separate. See, that is the difference between the word filling and restoration. Filling is just adding up material. Restoration is restoring the contours and forms and the shape and size and color also, right? So this is the major catch when we talk about the clinical appearance. The refractive index of the material should match enamel. What will we do by matching it with dentine? Nothing you will achieve. As such, you know dentine is darker than the enamel or more opaque than the enamel, is more translucent, transparent in the tooth. Then comes the second aspect. This is my molar. These are the three layers of your tooth: enamel, dentine, and pulp. Suppose I have a cavity like this, which is very close to the pulp. RDT is, say, suppose zero point 0.5, less than zero point 0.5. Okay. Yeah, that's what I am coming to, Dr. Shreya. Have some patience in life and you will get the answers. Now I am doing a restoration. And when you take a X-ray of this restoration, what do you want the material to look like? You want the material to look like enamel, you want the material to look like dentine, or you want the material to look like pulp? Answer yourself. I will not answer this now. In your common sense, the filling on X-ray should resemble what? If it resembles pulp, it will look like you have already entered pulp. If it resembles dentine, you will never be able to distinguish the material with the caries. You will always feel there is caries in the dentine. If it resembles enamel, then definitely this portion, enamel portion, will get maybe merged or maybe little darker, but this portion, the portion which is in dentine, will be more bright, will look more white in dentine. So you always can correlate. This is my enamel and this is my dentine. If this portion is so dark, you can always distinguish it from the caries. I hope you got the point and understood this point. So this was an age-old question, maybe a decade back in All India papers. A restoration or a filling material or a crown on radiograph should have radio opacity either equal to or that of enamel. It cannot be correlated with dentine or pulp radio opacity. Otherwise, you will go mad. You did a beautiful restoration, and once you took the X-ray, it will look like there is a caries in dentine. There is no point of such restoration. Okay, चलो मजा आ रहा है? Like understanding now, solving questions and understanding also. Question number 10. Concentration of fluoride in the immediate vicinity of glass ionomer. Glass ionomer is having very high fluoride release. Silicate has got the highest fluoride release. Then we have glass ionomer cement. Then we have RMGIC. They are equal as per the new editions of the Phillips, okay, which is more than zinc polycarboxylate and which can be more than fluoride releasing composites. This is the order. This is same as per the new edition of Phillips. But since it is a little controversial, as such in Phillips it is not controversial. If the question comes like this, which of the following has got the highest fluoride release? See, to best way, I always tell best way to solve the controversy is know what is the controversy. Okay, we know one fact, GIC is similar to RMGIC. So in this, without doubt, mark RMGIC. But if you know this is a controversy, some literature says GIC is more than RMGIC. It's not other way around. So here you mark GIC. If you know what is the controversy, you can handle it, you can tackle it, you can solve it. There is no point getting afraid of such questions and leaving them just because you think or you are less read about the controversial part of that question. Smart students, topper students never do such mistakes. These questions are tricky questions, but in last 20 years, this is my 19th year of coaching, I tell you such questions don't come in the exam. All the students who are running after the so-called controversial questions, there might be say 20, 30, 40 controversial questions overall in your 19 subjects. Yeah, chalo max 50. You take up any all NEET paper, forget about all India. All India used to have controversies. Okay, but NEET has categorized in a so fashion that end of the paper there is no controversy in any question. So those out of those 50, hardly one might have come in last 7, 8 years. Hardly. Okay. Yes, Dr. Anirudh. See, as per Phillips, GIC is this. As per some other literature, GIC is more than RMGIC. But RMGIC is never more than GIC. This is not true. Right? The concentration is 5 or more ppm. That is why it has got anti-karyogenic effect. Which of the following explains the anti-karyogenic activity of glass ionomer? Which of the following explains the anti-karyogenic effect of glass ionomer? Increased acid resistance to enamel. Yes, because of fluoride. Enhancement of remineralization. Yes. Inhibition of carbon metabolism of the acidogenic microflora because of fluoride. So all of the above. Fluoride inhibits which enzyme of glycolysis? All those who have read glycolysis biochemistry recently. Enolase. Step number 9, enolase. Chalo, great. I think all those who have studied glycolysis with me this year, last year, I'm sure you will not forget glycolysis. Which of the following is a mechanism by which Dr. Salma, GIC is not bacteriostatic, but it's a fluoride release which is making it a bacteriostatic or cidal. Fluoride will inhibit enolase. Enolase will kill the bacteria, so it is cidal. Okay. Which of the following is a mechanism by which fluoride has been incorporated in the different material? There is a physical incorporation of soluble fluorides. Yes. See, these kind of questions are not, you can say, I always tell these are info questions. So always when you are getting these kind of questions, say question number 11, question number 12, isko na circle karke rakh lo. Because they are the questions which are giving you some added information which are usually not covered in lectures. Usually. Okay. So which of the following is a mechanism by which fluoride has been incorporated in various dental materials? There is physical incorporation, incorporation of nearly insoluble fluoride as a mineral, as a filler. Use of monomers with fluorine in pendant groups at matrix. All are true. All of the above. Nowadays, we don't get these questions in NEET, but these questions can always come in the statement questions where you have to mark true or false. They can come, but very rare. In last 8-9 years of NEET started in 2017. Like the first NEET paper was in December 2016, right? So basically for 2017 batch. Earlier the NEET used to be in December, then January, then March, and now it is always in a dilemma whether it's January, February, March, or April. So these kind of questions usually don't come. The answer is 96. So I don't think you need to cram. See here, so one more thing in PAATHSHALA we are going to do. We are going to give you so many questions. We have already given you so many, plus we are going to give you more. Okay. At times where we feel no, Dr. Gidney not required at all. Okay. If you can remember some, it is good. Otherwise, it's not relevant. Okay, like gypsum, amalgam, casting, and all these are little bit you can remember, not much. What I want to tell you is when we are giving you so much plethora of MCQs, there might be some MCQs which are of no sense. Okay, we have not done एक MCQ ka scrutiny and then like put it in the question bank. Okay, we wanted to cover as many as possible, so we have done put up a lot of questions. So during the discussion, we might have to tell you that this question is making no sense. Okay, so you can just put a cross, or you can just just mark the correct answer and leave it. Okay, some questions I might have to cross also, that this question is not at all making any sense. Okay, which of the following does not set by acid base? You can tell me. This is a repeat question. Resin cement. I won't waste time on this. What is the recommended film thickness of luting agents? Now you tell me. This is as per Phillips. Question number 15. Yeah. 14 ka D. 15, 15, 15. 25 or less. Less than equal to 25 microns. How much should the internal surface of the crown be filled when luting a single crown? It should be half filled. Okay. Disadvantage of fully filled. Lot of flash. Will incorporate air voids.